When food is digested, it is broken down into glucose, also known as sugar, which creates energy and strength to our cells. Insulin, a hormone produced by the pancreas, transports glucose from the blood to other cells of the body. However, if there is not enough insulin or the insulin is not working properly, then the glucose stays in the blood vessels, causing the blood sugar level increases. There are three main types of diabetes: type 1, type 2 and gestational diabetes. Type 1 is when the pancreas is no longer able to produce insulin and is usually the case typical for children, teenagers and younger people. Gestational diabetes usually occurs near the end of pregnancy and usually disappears after delivery. The most common form of diabetes is type 2. Risk factors include being overweight, physical inactivity, a parent or brother, sister with diabetes, or gestational diabetes risk in women who had given birth to a baby weighing more than 4,000 grams, high blood pressure, decreased good cholesterol or a high level of triglycerides. When poorly controlled, diabetes causes lower or higher blood glucose levels. Diabetes that is poorly controlled over time can lead to complications that affect. Problems may occur everywhere, from the eyes, kidneys, nerves to the reproductive organs, blood vessels and gums, but the most serious problem is the heart disease and the risk of stroke. Meals may or may affect diabetes or to prevent it, and everything depends on the ability of the body to decompose glucose. You should avoid foods that increase blood sugar and cholesterol levels, such as processed foods, foods high in saturated fats and foods with added sugar and various syrup. Processed foods and foods high in fat and sugar will not only interfere with the balance between glucose and insulin, resulting in inflammatory processes, but also contribute to one of the risk factors, overweight. Carbohydrates must also be supervised. While they are necessary to allow fuel the body, some carbs make glucose level higher than the others. The glycemic index, GI, measures how foods that contain carbohydrates raise blood glucose levels. Dried peas or beans, legumes, all non-starchy vegetables, wholemeal bread and plain hot cereals have a low GI. Eat reasonable portions to avoid excessive weight and include fruit and vegetables. More fish than meat, beans, legumes and liquid oil. Limit saturated fat and high-calorie snacks and desserts like chips, cookies, ice cream. 30 minutes of exercise several times a week and you will lose 5 to 10% of body weight if you are overweight. This is also a key factor to prevent the risk of type 2 diabetes. Finally, if you feel the following symptoms: frequent urination, extreme thirst or hunger, a great weight loss, fatigue, blurred vision, or frequent infections, you should see a doctor to check your blood sugar. With great care and emphasis on healthy lifestyles, diabetes can be kept under control.